Well, good morning. As David, he's introduced myself, but before I even begin, let me take a moment. I think it's appropriate to express, my deepest sympathies, and my prayers go out to the family and the young lady that has endured this horrendous sexual assault. Suffice it to say, I take these matters very, very seriously. With that said, as has been indicated, I have been retained by Hacienda to do an independent review of the facts and circumstances surrounding this, all of the factors that went into why this matter occurred at Hacienda. But before I get into, a little bit more detail, let me take this back a little bit because I think it's kind of important to understand how my representation came on board. A week ago, yesterday, I was contacted by representatives of Hacienda, and they asked me would I consider doing an internal review of the facts and circumstances. We had long discussions that day. It was on a Sunday, and I said, well, I don't want to decide on anything at this point. I'd like to meet with the leadership of Hacienda as well as the president of the board of directors. And so that very next day on Monday, we had a long meeting in which I laid out a number of factors that they needed to be aware of in order for me to take on this representation. I let them know that I do take these matters quite seriously, and that when you begin to do these internal reviews, you find out things that maybe you did not know, and I was not going to be one that basically buried it. And that they had to understand that, and I had to get assurances that they wanted to correct this matter. The president did give me the assurances that these matters were to be taken seriously and that they wanted to correct this. I also indicated that although I'm very good at doing these types of reviews, as you might imagine, I needed a healthcare professional that had an expertise in this area to be retained as well, that would be working with me during this entire review. Because I don't know all of the dynamics around this type of healthcare issues, and I wanted to make sure it was a thorough review. They have agreed to retain an individual to assist me in this matter. We're currently in the process of retaining someone. I do not have a name for you at this point in time. So I told them that I was somewhat inclined to do that, but I wanted to meet with the full board of directors with Hacienda because I wanted to make sure that I had the support of all board members because, they needed to understand where I would be coming from. I did meet with the board of directors. They all, to a person, gave me assurances that they wanted me to look into this matter, to keep it thorough, to keep it objective, and the facts will lead where they lead. And they gave me assurances that they wanted to not just find out what happened, but they wanted to correct the situation. So with that, I agreed to take on that representation, and I believe I signed my contract with them last Friday. So I think that's an important backdrop on this matter, because many of you don't know my background to any great extent, but I've been brought in on a number of investigations, and I always let them know that sometimes there's facts that come out that maybe you don't want it to be, but they are going to be what they are. So with that, I've taken on the representation, and I've just begun. I haven't really gotten into anything yet, so I can't answer a lot of questions, and I would take that to the board first. But in addition to that, I am to also be kind of a liaison to law enforcement and local, federal, and state agencies to ensure that Hacienda cooperates fully in their investigations. I do have those relationships that I think that will make sure that they feel comfortable, that they can come to Hacienda and make sure that those things are handled in an expeditious manner. So with that, that's kind of the outline of how I came on board as the representation in this matter.
How do you see your review being different than, say, what the police are doing?
Oh, very different. Police will not look into the protocols, by way of example. They won't, they're trying to find who the perpetrator of this horrendous crime is. They're not going to look into the management practices, the security of the patients for potential future harm, those matters. I mean, I will tell you that one of the first things that I will be doing is I will be going in there and I'm going to be looking at the security surrounding the entire facility to make sure that there's no future harm to any of the other patients. I'm going to be looking at everything from how visitors come in, what security guards that they have there, are there cameras there, are doors locked so that nobody can just be walking in, those types of things. So I'll be looking at the security issues first. I think that's probably the number one priority. We want to make sure that this never happens again.
Rick, are you going to make your findings public?
With that, I would hope so, but I will be presenting it to the board of directors, and it will be my recommendation that as much information as can come out will come out. I think that that's really critical. The community needs to restore trust in the organization. I've met with several of the leaders in the organization, and they care deeply about their patients, and this has had a huge impact upon them. And my own personal belief is that the openness of what we do is critical to restoring that trust. It's the first step.
Was that part of your negotiation with them, that this, whatever you find, gets put out in the public so that the community can get more confidence in this organization?
Not specifically, but it was discussed about how do we restore confidence and public trust in what the organization is doing.
Hacienda Healthcare has been around for a long time.
Yes.
Have they shared with you when they had their last safety audit?
No, I have not seen any of those. I've got some peripheral information that's been brought my way, but I'll just tell you the way that I do business. I will hear a lot of things, but I'm going to want to see it. I'm going to want to read it. I'm just not going to take somebody saying, well, this occurred, because I've learned maybe that's not the entirety of the issues. But I will be looking into that. I'll be looking at their safety audits. I'll be looking at complaints. I'll be looking at their protocols. All of that's open. They have given me absolute assurances that the books are open to me.
Rick, if you come across wrongdoing, are you going to notify law enforcement about it?
It's every bit my intention that we will not hide a thing from law enforcement. And I will be, of course, I would bring it to the board's attention at that time, but let me state this, that I will not be part of any type of situation where law enforcement would not be provided information regarding the situation, the woman, and all the facts and circumstances surrounding it, because that's my limited area at this point.
So your role in this is limited to what happened to this woman, not what if you're not looking into other things that might...
No, but if my investigation rolls into it, say for example, I come across information that maybe impacts the past practices that are potentially criminal, I could see my investigation opening up to those particular areas, because that's the thoroughness that I would expect of this.
Do you anticipate DNA, collecting DNA samples and going down the DNA route to be part of your internal review?
No, that will not be part of mine. I have no authority to get subpoenas, search warrants to be able to take that DNA. Law enforcement, that's law enforcement's role. All I can do is, at best, encourage leadership, to encourage the employees to provide DNA voluntarily. If not, then the police can obtain a search warrant to get it.
I know you said your understanding of their practices is limited right now, but do you know if they had any policies in place to help staff identify sexual abuse?
I don't know.
Okay.
Rick,
I've just started.
Rick, when you say you've talked with leadership, does that include Bill Timmons? Was he involved in these conversations? And have you had a previous relationship or interactions with him before?
No, I have not had any discussion with Mr. Timmons. He resigned during our discussions before I accepted representation. I have had no, at least to the best of my knowledge, I don't know who Bill Timmons is, other than what's been reported in the press. I've had some discussions about Mr. Timmons and his prior oversight management of the organization, but it's just peripheral.
But your access will include talking to him in this review?
It probably will. It probably will. And, you know, I'm going to attempt to talk to everybody, including the medical professionals, the medical doctors. I mean, we all understand what the questions are. I mean, we all understand how could this not have been identified earlier? You know, why, what happened here? All of those things I'm going to try to ferret out. I mean,
There's a concern that by the board or the president hiring, obviously, somebody outside of state regulators, state inspectors, even police officers, that maybe there is a concern that whatever results are brought out, that they may not be shared with everybody, and that might be swept under the rug. Why not just go with state investigators or inspectors?
well, I understand that. This is for their state inspectors will be looking at just simple things. You know, they may not be looking at the totality of all the facts and circumstances surrounding this situation. You know, I want to be looking into what was the culture within the organization. You know, is there, you know, you turn a blind eye. You know, although the state will be, would be concerned about that, that's a specific, well, let me back up. Let me start this again.
Because you're a private company, I guess the concern is you're not obligated to share any of that information. Once
No.
you cover it.
No, I'm not obligated, but as I indicated, I think it's really meaningful that the board has brought in somebody outside. The state regulators can still do what they want to do. I mean, they will be part of this. There's no question at all. I will be in regular contact with them. But I think it's meaningful that the board has agreed to bring in somebody outside. And I think that, I think my reputation precedes me, that I call it as I see it. And if not, I walk away. That we're bringing in an outside healthcare professional. I think that's a responsible way by which, an organization should be conducting itself. The state regulators will probably be doing something at the very same time. They'll be looking at it. They'll be coming in. In fact, they've been there several times. I will be asking them, what is it that you see that maybe the organization is not doing? Because we want to work with you. We want to get this back. We've got to remember here, we have a number of patients that, some of the most vulnerable in our society. They need to be taken care of, and there needs to be assurances, not just by the public, but by the family members and so forth, that this organization is going to do everything that it takes to correct the horrendous facts that led up to the impregnation of the young woman.
What's
So,
the timeline of your investigation?
there is no timeline. Everybody should know that investigations are just that. You think it's real simple, and you turn over this rock, and it leads you into another direction. If you want thoroughness, sometimes it could be as short as 2-3 months, up to, who knows how far out it goes.
Does
What's
your
the
contract
very-
have a specific date?
I'm sorry?
Does your contract have a specific date?
No, it does
How long
not.
will be employed?
No, it is for the project itself.
Okay.
What's the very first thing you're going to look into?
It's going to be the security and welfare of the patients. As from the facility standpoint, and to make sure that, any potential future issues can be addressed almost immediately. And that's not just the physical facilities themselves, but I'm going to have questions about doctors that we're seeing the young lady, or, what happened there? I mean, what are the circumstances? I think we all know that a person can be pregnant and you may not notice it. As county attorney, I can't tell you the number of cases I would have where there was a molestation in the family, and the mother didn't even know that their daughter was pregnant until almost the birth. I mean, it can happen. But I don't know enough of the facts yet. But the first thing is, of course, the safety and welfare of the patients.
Are you able to share information along the way?
I'm sorry?
Are you able to share information along the way in this investigation? Are we going to have to wait till the end for some of it to become public? For example, if you determine that none of these employees are suspects, are you able to share that information? Or are you able to say that family has been ruled out?
That's really going to be more dependent upon what law enforcement desires to do. Law enforcement will have access to the DNA. I probably will not be told any of that information. They may share things with me, but they may not. It is their separate investigation, and the number one priority beyond the safety and health of the patients is to catch the perpetrator of this horrendous crime. So, but will I be able to share information? That's going to be dependent upon some of the information that comes out, because timing matters. I mean, I may come across some information that I need to do further follow-up and further follow-up and further follow-up. What I do hope is that as we begin to make, some things are identified, that we make the changes immediately, and I hope that does come out. By way of example, you know, perhaps we need to have cameras in the halls. You know, you can't have it in the rooms, but in the halls. If that is done, I would like to be able to get that information out, because that's getting out information that we're serious on those things. And that's what you're going to be gauging us on. How serious is Hacienda to correct the deficiencies as they may exist? And I would hope that we can get out as much information as possible, but I can't guarantee everything that I find at this moment will be coming out.
We've heard a lot from current and former employees there, that there were complaints given internally about the doctor there. Is that something you're gonna look into?
Of course. I'm going to be looking into it. I think that that's a critical part of this. You know, I don't know all of the facts and circumstances surrounding the impregnation and her care on a daily basis. But of course, that's of concern. You know, and are these doctors a family doctor? You know, where they brought them in? Is this is this an independent contracting doctor? I don't know all of those answers at this time, but I think that that's a critical component of mine. You've got to have good health care for these patients, and to me, that's probably one of the most critical issues.
Who is the acting CEO?
I'm sorry?
Who is the acting CEO?
His name is Patrick White, and I've met with him on numerous occasions, and all I can say is that I am confident that he wants to do the right thing as well.
Going back to your statement about reporting any new information to police, we've heard from several employees and former employees about a systemic culture of fear under former CEO Bill Timmons of him threatening people to not come forward with certain reports that would make them look bad. We've heard of fraud investigations against the state. We uncovered information about him ordering medical staff to change records so as not to be liable for any responsibility for death or injury. In the event that the evidence does show up and you find that there was some criminal wrongdoing with the former CEO and how he ran the agency, any hesitations to report those possible criminal findings?
From my perspective, no. I think it should be reported. Look, I've heard a lot of talk, you know, just these few days that I've been on board, and I think that you have to look at those particular situations. Let me tell you what I've learned. You know, I've conducted a lot of these. I've been brought in on many high-profile investigations, including in Washington, D.C. for the Secretary of Veterans Affairs when they lost all the data on veterans. The Secretary brought me on board to be his personal advisor to look into the situation. I've learned a long time ago that when you bring in an independent body such as this, and not even a regulatory body, people come forward and will talk to me before they will talk to even the CEO, before they will even talk to state regulators. They will come and talk with me. And in the end, I'm going to do that. I hope that they feel comfortable coming forward and talking with me. It's the only way that we're going to be able to ascertain what is going on. And I think that those are all fair inquiries. And if it goes to Mr. Timmons, it goes to Mr. Timmons. What's important, though, and I really hope that this is understood out of this press conference, it's a new day. I mean, you've got a new CEO on board who I am convinced is committed to do the right thing. I've met with him over a half a dozen times in just this short period of contracting. You have brought in an outside individual to look into this matter with an absolute unquestioned statement that there's not going to be any types of cover-up, and I have had assurances from the board that we're bringing in an outside, independent healthcare expert in this field to look at things as well. I think it is a new day, and what happened before, if you're not going to be repeating history, you have to know what that history was. And so if things come up regarding Mr. Timmons, it will be looked into.
Have you been able to go inside the building physically? I know you just
Yes.
went on.
Yes, I have.
What were your first observations about security? Because we've heard from people who have family members there who say security is lacking.
I know that they have, I've read in the reports that they've locked up the back doors and so forth, and the reason for that is that the administrative buildings are behind it, and easiest way in and out was through that way rather than walking all the way around to the front. But they have been secured. I've heard that they've put more police officers on board. They are sworn police officers now rather than a security company. But that's all that I know at this point in time. I know that they brought to my attention, for example, some of the employees are very fearful, because they've had threats against them. And I've urged them that, you've got several officers here that shift change, you create a rotation capability where the officers escort the people out to their car, and then the next group comes back, and the next officer takes them out. So we're looking at that, but it's just real preliminary. But I know some things have been done.
Is that what we might have saw when we were there early in the morning? A lot of police officers gathered in the front as employees would come in.
I don't know that day. I just know.
But that's what you recommended.
I've recommended that because they brought that to my attention in one of our first, as I hadn't even signed the contract yet. I was just there that early morning, and that's what I observed. And they brought it to my attention that there's a lot of concern there, and so it's real preliminary here.
Are there any other changes in procedure or security over there that you can tell us about?
I don't know. I mean, I wish I could. I mean, there's no doubt that the priority here is the health and well-being of the patients, the employees of Hacienda, and that's where my first focus is going to be.
Can you talk about objective, when you talk about being this third party coming in and investigating? I think people at home may want to know, how much is Hacienda paying you to be able to do this investigation? And can you speak?
Well, I'm no longer a government employee, so you're not going to get that answer. But I'm sorry, say the question again, beyond the pay.
How much is Hacienda paying you to?
Oh, look, that's private with my company, and I don't go there. I just don't do that,
When you got the phone call to take this job, or whoever that reached out to you, what was your initial reaction, Rick, when you heard from them? Were you hesitant, excited? What was going through your mind?
Well, truthfully, I wasn't going to take it. I just said, first of all, it's sexual assault. I take that seriously. I think those of you that have been around know me as county attorney. I was aggressive in that area. I think it's horrendous. And then you have the most vulnerable of our society being sexually assaulted. I'm offended by that. But then I began to meet some of the leadership, and they want to fix things. They truly do. And it began to win me over, that I began to say, you know what, I think that they really mean business here. And then, of course, when I met with the board, the board gave me the assurances, and it has to play out that way, because that is an absolute term that I let them know, that there has to be sincerity, that they really want to find out what's going on, and that there has to be corrective measures. But I wasn't going to take it, quite frankly.
For this project, how many people will be on your team?
Right now, just the healthcare professional, myself, and any staff that I might need. Of course, I have access to all employees to help me with whatever I may need, everybody. So I will have full access to staff to pull.
Will be on your team to go through this project?
Well, let me answer it this way. I will have two people, myself and the healthcare professional, but I will also have in support, if I need financial records, if I need policy records, I will have those staff assigned to me from Hacienda. But I will be reviewing those with the healthcare professional ourselves. We're only using them in a support role.
Hacienda has a history of ratings also.
Sorry?
Poor ratings for Hacienda. On top of that, there's like a state audit, obviously, that was concerned with fraud. Is it your impression that the board maybe didn't know about this at all? What was their impression? I mean,
Well, I don't know much about the ratings, but it's my understanding they had very, very good ratings from the state up until a year ago. And I asked about, how can a facility have gone from a 5-star rating to a 1-star rating in a 1-year period of time? And it's my understanding that there was some type of a computer change program by the state on reporting, and that they didn't accurately report it due to the new program, and that's all that I know. That's all that I know at this time, and that's why, because it wasn't done correctly, properly filled out in a timely manner, that they automatically give a 1-star rating. That's what my basic understanding, but that's all that I know.
but even the culture, for example.
Oh, but that's not a rating. That doesn't go. I don't.
Right, but at the same time, I mean, is it the board's contention that they didn't know about any of this?
I've got to find out. I'm just starting. I did hear that there was a real, I'm not sure the right word, but there was a real stress between Mr. Jeffries, the former head of DES, and Mr. Timmons. And so that goes into my consideration that I've got to be very, very objective. Why did that occur? Did part of the problems arise because just bad blood? Or is there real objectiveness to it and so forth? But I'm not focused on the access side. That's not my area of expertise.
From the police interviews and press conferences they've had, it kind of seems like almost everybody is a suspect. No one's not a suspect. Is that the same kind of sentiment in your investigation?
Well, first of all, you don't rule out anything until you have more definitive evidence. I mean, it's open-ended. You don't know what you can do until you begin to get into it and be able to solidify some of the information that you have. And let me make it real clear. I'm not going to just take the information as it's told to me. I'm going to try to validate it through records, through policies, personal interviews of individuals, those types of things. So I'm not taking anything at face value.
Once you identify that healthcare worker that would be on your team, will you publicly share the name?
I'm sure we will. I would. Why not? I think it's absolutely fair.
Have you had any conversations with Mr. Jeffries or the current
No.
head of DES, or do you plan to?
No. Well, Mr. Jeffries, no. That would not be it. But I do plan to reach out to the state. I want to let them know that we're going to be working with them. Let us know. If there's any issues at all that you have, bring it to my attention. And we'll go from there. I look at open communication, the openness of what we're trying to do here, I think, is absolutely critical if there's going to be any assurances that things are going to be fixed. And from my perspective, something needs to be fixed. I mean, I don't think that's much of an issue, so.
If we were to go back 9 months ago from now, what tools do you have at your disposal that will allow you to maybe see who was coming in and out of that room with that patient at the time? Are there cameras, and do they go back that far? Are you relying on simple sign-in paperwork?
I don't know the answer to that, but first question you've got to find out, was the child full term? Because that changes the whole time period. You can go back 9 months, but what if she was only pregnant for 7 months? If it wasn't so there's a lot of things before we even begin to go there. But you're right. You do need to look at everything, and I assume law enforcement will be doing that. Everything from including prior employees that were retained at that time that may no longer be there. I would assume law enforcement would be doing that. That's what I'd be instructing law enforcement to do. Let's find out every employee that was there at that time. Even if they're there now, fine. If not, we need to consider them to be in this pool of people that we might need to interview and so forth.
Do you know if the patient has that room to herself, or does she have to be?
I don't know.
For a large city, Phoenix is actually pretty small, and Hacienda's been around for a long time.
Yes.
You've been around for a long time. Do you have any personal relationships with any current or former board members? Any of your friendships?
No, I don't believe any at all. Now, remember, I was elected. I don't know if anybody contributed to me or not, but not to my knowledge, you know, because I was county attorney for a long time, and of course you raise monies and stuff like that. But from my perspective, and they didn't indicate that they knew me when I met all the board members in the past, so none. And I wanted to make sure that they understood my background, who I am. And, you know, I mean, I brought up everything. I'm a Catholic. I brought up the Catholic Church investigation. You know, I've told them that it may be very painful, but the facts, they're going to take us wherever it goes. And there's probably going to be some very difficult moments and stuff like that. But they assured me they wanted me to do that. They assured me that they wanted to fix the problems. That's the best I can give you.
Do you think that you have a trail to follow on, or is this literally like a needle in a haystack trying to figure out where you start?
Too early to say. I mean, and I wish it was super simple, but I have a feeling it's not going to be. I think this is going to be very, very complicated. And I think it's going to be difficult for law enforcement, to be truthful with you. These are not generally easy. And, you know, they've got the DNA tools, which can be of great help. But if you don't see something within a short period of time, then they're probably starting to focus outside the organization. And that can be very, very difficult.
So when this is all said and done, are you confident that we will know who started all of this?
I cannot give you that. You know, and I know this is kind of the ultimate detective story of who done it. I hope and pray, quite frankly, because, quite frankly, the person's a little sick.
Is this the most puzzling case you've ever worked on?
No, by far no. Trust me, those of you that have known me, I have handled bigger cases than this, trust me. You know, international cases, from the Temple murder case, if you might remember that, where I had to go against law enforcement because I felt they arrested wrong people, so.
If Hacienda cares so much, why now? Why not several years ago when there was fraud and all that came to light? Why now?
You know, I don't know anything about the fraud itself, but of course, clearly the situation as it exists, the impregnation of a very vulnerable young woman and the birth of a baby, how can you not, you know, how can you not address it now? Now, why not earlier? I don't know the answer to that. All I know is that I've been told they had 5-star ratings in the past, and it's just this recent year, I did ask that question. How did it go from here to there? And they gave me this peripheral answer, but I haven't been able to validate that. So I wish I could give you more answers, but I can't.
Probably a good
Also,
place to
are you going to be talking to family members of current patients at Hacienda right now? Certainly, we've talked with them, and they have a lot of complaints.
I would welcome the opportunity to speak with
Will you
me.
speak with them?
Well, here's a little bit of the difficulty. Of course, you know, the young woman has been moved out of the facility, as well as the child. And, you know, I've got to think about whether I reach out to them. I don't want them to feel like I'm intruding upon them or anything such as that. I hope that the press would let them know that I'm very willing to sit down with them at any moment, at any time, to talk about their issues and their concerns. And they probably have a very good feel for Hacienda. I mean, she's been with us, with Hacienda, since the age of 3. So, you know, I want to check into, has there been previous complaints? Those types of things by family members, whatever. And, but please, let the family know that I'm very willing to sit down with them and listen to them at any moment.
So you
What about
haven't
other
talked to the
family
victim?
members that are currently?
To who?
You haven't talked to the victim's family?
No, I have not. And I've got to question whether I should or shouldn't, because, you know, you've got to be careful not to overreach too soon, too quickly. I mean, I would like to. I've got to just think through that one a touch more. You know, I don't want them to feel any more strain at all by having somebody that Hacienda has employed to go and talk to them. I don't want them to feel any more uncomfortable. I want them to know, I hope that as the time goes on, they feel that they can come and talk to me and ask me, and of course I will. I absolutely will.
Couple more
So other
questions.
patients who are currently there and their family members, they're willing to sit down and talk
Oh, of course. I mean, I need to get my arms around what's going on inside a hacienda. I mean, that's pretty basic. And, you know, I want to hear the problems, but I also want to hear the good side of it, because I've heard a lot of people are very pleased with it. So I got to try to figure out where we're at.
If we think back to the Southwest Key cases not too long ago, some things that were revealed led to some of these locations being closed. What findings would lead for this to happen to Hacienda?
I'm sorry, say that again. I'm a little confused.
So if we think back to the Southwest Key cases.
Southwest Key cases, I'm not
the
sure.
Shelters for migrant children.
Oh, I see what you're saying.
What sort of findings would lead for Hacienda to be closed like it did happen with Southwest Key?
I mean, I think that you would have to find, you know, I mean, that's for the state regulators to be able to define, quite frankly. I'm not sure I'm expert enough to be able to say that at this point. All I can tell you is that the state regulators are in there all the time, and they haven't closed them for 50 years, so that's all I can say.
Last question.
Have you got to hear, I'm sorry, have you got to hear that 911 call that came out?
Yes, I have.
Friday?
Yes, I have.
What was your initial reaction as a former investigator to hear the reactions of the people in the room? There's a baby on the floor.
On the floor?
Yeah.
I'm not sure that the baby was on the
when
floor.
When they came out.
You mean in the
Yes, in the
unit?
room, yes.
Okay. I don't want to give an impression that the
Yeah.
baby was lying on the floor. My thought was, I mean, it's pretty simple. They didn't know that she was pregnant. That was my initial thought. They didn't know. I mean, that's what it sounded like to me. And so that takes me back to the medical doctors. You know, she wasn't, I mean, she was not a heavy woman. She was slight, but she's, well, I can't get into any medical things here because HIPAA. But, you know, the questions have to be asked of the doctors. You know, why wasn't this known ahead of time? I mean, that's the fundamental question to me.
Maria, last one.
Just to be clear,
Yes,
who is paying you?
Hacienda.